Hello and welcome to another edition of Tuesdays with Liz, Disability Policy for All. Today we are continuing our series on healthcare and people with disability. Today my guests are Caitlin Morris, who is the Program Director for Health System Transformation and Health Policy, and Dee Mahan, who is the Medicaid Program Director and Health Policy here at, and they're both here at FamiliesUSA. So welcome, Caitlin and Dee.
Thanks so much. We really appreciate the opportunity to be here.
Thanks, Liz.
The first question is, can you tell us about the Protect Our Care Coalition and what does it do?
Sure, so I can start. The Protect Our Care Coalition is a nonpartisan coalition of a number of different organizations that have come together to help publicize the potential effects of the repeal of the Affordable Care Act. And so this has involved a lot of research and messaging, working with members of Congress, working at the state level with state groups, all in the hopes of trying to slow down the train on repeal, trying to encourage a comprehensive replacement plan that will protect consumers, ensure that they have the same quality health care and coverage that they do now. And we've been able to engage a diverse, wide range of groups and bring everyone to the table to really publicize the potential effects of repealing the Affordable Care Act. Dee, did you want to add anything about the coalition?
No, I think that pretty much covers it.
We at AUCD are a member of the coalition, and we're proud to be a member.
Pleased to have you.
The next question is, can you explain what Medicaid block grants and per capita caps are?
Sure, I'm going to take that one. Medicaid is the program that I focus on in my work. And I'm going to start with how the program is today in terms of the payment, because the block grants and per capita caps would essentially be huge fundamental changes in the way that the federal government helps states pay for their Medicaid programs. So right now, Medicaid is a state and federal partnership. It's funded by both, and the federal government never pays less than half. So it always pays half of states' cost, most of the time more than half for states. And it's, how much is depending on the state's economy and stuff. It's a complicated formula. But the way the program works is whatever a state spends, the federal government matches that. So no less than $1 for dollar. And if someone's meeting the eligibility criteria for the program, they automatically get in and they get coverage, and the federal government matches what the state puts in. That gives states a lot of flexibility to deal with more people needing care, like when the economy gets bad and people lose their job. It also gives states a lot of flexibility to add services and programs, particularly when new technology comes around or there's a change in what's considered the best way to deal with situations, new drugs, new treatments, new kinds of therapy. Block grants and per capita caps would both change that fundamentally. So with the block grant, the federal government says each state's only going to get this much money, no matter what, period. And with block grants, there's a lot of tricky things about it, but generally it's a huge cut in the amount of federal money. So usually it's like the federal government's going to take 25% less than what it's paying now and give it to states. So states have to make up that money, and I'm just throwing 25% out as an example. States have to make up that money, and it's really tough to do. And they usually, with the programs, the proposals we've seen on the table would give states flexibility to cut services, cut programs, and that's probably what they're going to have to do. Per capita caps are just a different payment mechanism, but most of the proposals that we've seen also have big cuts in federal funding. States would get paid per enrollee, but at a lot less than they're getting right now. So both of these, in terms of proposals we've seen, are ways to cut federal payments to Medicaid, and it passes a lot of cost on to states.
That seems really scary.
It's really scary for us, and I think, one of the things that we're concerned about, people who have chronic conditions, more expensive care, use a lot more services, and that's what drives a lot of state cost. And we're really concerned that when you see these proposals coming out with big cuts, even if the cuts aren't immediate, a lot of times the proposals are structured so that the cuts happen down the road, so they don't look so bad up front. But if you do the math and say, man, in 5 years this is going to be terrible, states are going to look at the highest cost care they've got right now and say that's where they're going to look to cut, because that's where most of the costs are. So it is very scary for us. We're really concerned about what's going to happen to quality of care and options available for people, particularly people who need longer term care or more expensive care.
Thank you. You mentioned mechanism, and I'm not sure that a lot of my viewers will know what that word means.
Okay, that's fine, and I have to go back and think about what context I mentioned that in. I don't know if you can help me with that, Kate. But I think it was in terms of the program structure, the way
Yes.
it's set up right now. So right
Yes.
now, by law, the Medicaid program is part of law that signed in the 1960s by President Johnson. It's been around for a long time. It has been expanded on a lot as people's needs have changed and medical treatments changed. And the way that the state pays is what I'm talking about when I say the mechanism. So right now the state pays the way the federal government pays. So right now the federal government pays based on what states' costs are. With a block grant, that would change, and the payment would be not based on what a state's costs are, but just a pre-established amount. And the proposals that we've seen have formulas for how that amount would change over time and how the initial amount would be set. And it's those formulas, which can get very complicated, that usually incorporate a lot of program cuts at the federal spending level. And it gets very complicated and gives me a headache sometimes.
Okay, thank you. The next question is, how do they affect or benefit the people that get Medicaid, which are most of my viewers?
Okay, how program changes in the way the federal government pays would affect benefits is going to depend on the details, and as you know the saying, the devil's in the details, of what is proposed. Most of the proposals that we've seen give states a lot of flexibility, and that's a word states love to talk about with their Medicaid program, to change the benefits that they offer right now. And what an individual state would decide to do with that would really depend. But right now the federal government says if you want to get all of this federal money, state X, you have to provide certain services, which from the perspective of our organization is a good use of taxpayer money. I mean, if the federal taxpayers are giving all of this money to states, you want to make sure that it's being used to do certain things, and the federal government has an interest in making sure that there's at least some quality, across the board, that everybody in every state is getting certain things. So there are requirements. There are a number of states that would like to see those requirements go away. And they talk about needing to design a program that's just right for the people in their state. And the fact is, right now, there's a lot of flexibility in Medicaid. States can do a lot of different things. But what might happen is that the requirement to provide certain services could go away, and it would be totally up to the states. So some states may do, cover a lot of things, and other states could cover a lot less. You end up losing a lot of guarantees that people have right now in terms of services.
Okay, thank you. And again, that's scary.
It is scary, and it makes it very hard to advocate and make sure that you could move from one state to another state, and right now you can have that happen and lose, benefits could change. It could get much worse in terms of losing benefits if someone moves or something like that.
And talking about advocating, the last question is, how can people speak out and advocate on these issues?
I can take a stab at that
Sure.
one. We talked at the beginning about the Protect Our Care Coalition, and I know that you all are involved, but individuals might not have the opportunity or capacity to join in the coalition work, but there are a number of things that people can do to get involved. The first, I would say, is if you are willing, you can share your story. Personal stories are incredibly compelling and really sort of help add the human element to everything that Dee was talking about the risks of changing the ways that we pay for Medicaid have real human impact on the kind of services that people need that rely on the Medicaid program. The second is to call your elected representatives and tell them what healthcare means to you, or how you might have benefited from Medicaid or the Affordable Care Act. That can be really powerful in knowing that a constituent who has voted for an elected representative has, taken the time to reach out and share their opinion. Any other things that you can think of, Dee, that we might want to add?
Well, I think the personal stories are really important. FamiliesUSA has someone on staff who spends all of her time working with people, going over stories, and then connecting people who are willing to tell their stories to journalists who are reporting, members of Congress who might need someone to testify. I think that can't be underestimated, because really putting a human face on what could potentially happen and how real people can be hurt is really important. And I know a lot of times it's really hard to get in front of a camera and open yourself up or talk to the public, but it is really, really important. And then working through organizations, if someone is willing to be a spokesperson and work with different groups within the community, that's very, very important as well. And that can include everything from advocacy groups, doing work like you do, which is incredibly important, helping get the word out and inform people, working with community groups, church groups, whatever, just getting out and saying, this is a problem that can affect everybody, and we all need to work together on this.
And I'll just add that if any of your viewers are interested in sharing their story, they can go to FamiliesUSA.org, and there's a button for Share Your Story. It'll connect you with a nice lady named Kate who can walk you through the process.
Okay, and we'll make sure that website is goes out.
Great.
Goes
That'd
out.
be great.
That'd be great.
Thank you. And if you have any more policy issues, please. If you have any more questions about this or any other policy issues, please go to this week's In Brief and on the AUCD webpage. And if you have any questions or comments about this week's Tuesdays with Liz, please leave them in the space below. Thanks, and have a nice day. Thanks, Dee and Caitlin.
Thank you.
Oh, thank you so much. We really appreciate this opportunity.
Thanks, Liz.
Bye.